Why should reminders change? Carrying out vaccination reminders once monthly can cause multiple different problems for the clinic, owner, and animal the reminder is for. Let us start with the pros before moving on to the cons. Writing handwritten reminders for the clients can help them feel appreciated knowing time was spent writing out their reminder. This reminder can be placed onto a notice board that will be looked at regularly, reminding them every time they walk past. By having one person carry out the task, it helps prevent anyone being forgotten and they are all done the same way. If something goes wrong with the reminders, the clinic manager can go straight to the staff member and get them to fix any problems that occurs. With some vaccinations, such as FIV vaccinations, they need to be given on time, and if not, the course needs to be redone. Carrying out reminders once a month can create boundaries for being late at giving the vaccination. Using addresses is a touch-and-go way of giving information, due to the chances of letters getting lost, which would create the same problem as someone moving. If addresses are used, it means they need to be constantly up to date to work. This is difficult to do as people moving forget to update their address. If addresses were sent and didn't get to the owner, this would cause vaccinations to be missed, creating issues for the animal. One day every month is very expensive for the clinic, as it is a whole day of pay to go to one task. Working that out on a $20 per hour income, doing 8 hours a day equals $160 per month just to do reminders. Adding ink, paper, and stamps required adds up and makes it a very expensive way to do reminders. If the owner has multiple animals that need different vaccinations, it can become quite confusing receiving multiple different reminders for their pets. Sending multiple reminders to one home also creates more cost, needing bigger envelopes and requiring more printing. Having one nurse write everything out can become quite uncomfortable for the nurse. Writing out multiple letters can create cramp in the writing hand, which therefore causes discomfort. Sustainable changes. The first change that could happen is changing to electronic reminders. This is a lot faster and more effective as everyone has cell phones or emails now. It would eliminate the problem of having people move houses, as people hardly change their email or cell phone number as they move. Changing this way would prevent using a lot of paper and make the clinic more environmentally sustainable and create less waste. The cost of reminders would greatly reduce, as the clinic would spend less time doing reminders, because if you had a good reminder system, you shouldn't have to type anything through having pre-made reminders written to copy and paste. This would mean it would only take 2 or 3 clicks to send one reminder on the computer. Whilst doing this, more reminders can be added to the list, which would save more time and start creating better service for the clients and the animals. Benefits. Computer-based reminders create opportunities to make money through sending out reminders for worming or repeat injections. As everyone tends to forget about worming, by reminding owners to buy worming, it helps bring more money into the clinic. You can also create reminders for post-op care, along with other reminders which would benefit the client and animal by ensuring everything is going well after surgery. This benefits the clinic because you are bringing more return on investments into the clinic, such as having to come to buy worming tablets or requiring nurses to give repeat injections. Reminders would be able to be done at any point in time, quickly, and by anyone, so no one nurse has to do every notification. When there is nothing for the receptionist to do, they could send out reminders to take up time throughout the day. It would take 1 minute to do one reminder instead of 5 minutes per reminder if you were writing them. By offering multiple different reminders on the computer, owners can be sent reminders for multiple different things, which would provide a better service overall. This would improve the health of the animal and encourage the owner to come back, therefore bringing more money into the clinic. The clinic's environmental sustainability rating would increase through decreasing the amount of paper being used and decreasing the amount of rubbish produced. evaluation, and my reasoning. Throughout my 2 years of studying vet nursing, I have worked in clinics that have used electronic reminder systems. It is so much faster and taken literally 2 clicks to send all reminders. This is due to heaps of pre-written reminders being available to select and then send to the owner through email or text. Within the text messages, the phone number of the clinic is always included, and it creates the opportunity for the receiver to click the number and directly call us if they have any questions or if they need to book appointments. The majority of the clients who come into me in the past clinics I have worked at has stated that they have been reminded to come back. This shows that it is working. Completing reminders on the computer works well because if there are multiple reminders required for multiple animals in the same house, such as 4 dogs to vaccinate, one reminder can be sent for all of those dogs simply by highlighting the name on the computer and pressing the vaccination pre-written message. Some owners come into the clinic and don't bother receiving vaccination stickers or vaccination books for their pets and simply rely on the reminder system. This shows that the system works well and people are appreciating the reminders they receive and finding them easy. Overall, I believe using the reminder system is an overall better system that everyone will enjoy having in place. It will make the clinic more financially and environmentally sustainable, take up less time for the nurses that the clients enjoy having around. Improving the reminder system to text and email reminders will create less risk and reap more rewards. Now, I carried out a survey on random clients, and this is what it looked like. Now, I did it over a range of different clients, elderly, teenager, and 20 to 30-year-olds, just to see what they thought about receiving letters in the mail. Now, my survey content showed that 10% of people enjoyed receiving letters in the mail. 60% of people said that it was the best way to get hold of them through texting, not through letters. 30% of people said that the best way to contact them was through email. So this shows that 90% of people have said that they don't want letters in the mail because they don't find them the easiest way to get a hold of them. So that concludes my presentation as to why reminders should be changed to electronics. Thank you very much.